This is chapter 53. We're going to be talking about care of the patients with oral cavity problems and, more to the point, stomatitis. Stomatitis basically is just a really broad term. It refers to inflammation inside a person's oral cavity. It can be present in multiple different ways, but there are multiple ulcerations, kind of like canker sores or mouth sores. They're very inflamed, and they kind of erode on the protective lining of the mouth. They can cause a lot of pain. There can be open areas. They can bleed, and they can also put your patient at risk for infection. The very mild form can respond to just some specific topical treatments, but if it's very extensive, they may be required things like morphine or Demerol and some antifungal medications. It just really depends on where the source of the inflammation is coming from. Stomatitis is classified according to what's causing the inflammation. The primary is the most common. The secondary will come from an infection, any type of a virus, fungi, or bacteria, especially for those patients who are immunocompromised, those with cancer, HIV, and it can also come from patients who have been given chemotherapy or radiation puts them more at risk for having stomatitis. And also, you can see this with patients who also have candidus or thrush, which is also known as yeast. So caring for someone who has a disorder of the oral cavity, you need strict oral care. You would do a lot of the same things that you would do if a patient had chemotherapy. Use really soft toothbrushes or even like the toothettes. Then you really wouldn't want like lemon glycerin swabs, but definitely swabs that didn't have much of a taste. An alcohol-free mouthwash. We're going to treat these with antivirals and antibiotics. There's one called Miselex Troche that treats for those people who have candidus or yeast. They'll put the troche in their mouth and suck on it, and it helps get rid of that. They can also do warm saline rinses every 2 to 3 hours, or do baking soda and saline every couple of hours. And something else to remember with stomatitis, it can also be caused from allergy or vitamin deficiencies like vitamin B, folate, zinc, and iron. Tobacco and alcohol can play a part into this disease process as well. And also certain foods, acid foods, Mexican type foods, coffee, cheeses, nuts, anything that is fermented. So a lot of these people will need to have special diets and eliminate these specific foods from their eating programs. And a lot of times that will help clear up the stomatitis. And even though that you can take and kind of wipe these patches away, sometimes the surface underneath is still going to be red and sore. So, you still need to be mindful of that. And this is just a picture of what the stomatitis looks like. If you look on the right side of the picture, they just look like your basic canker sores, but these are very, very painful. This is hairy leukoplakia, and you see those nice, really big white patches. Well, those white patches cannot be rubbed off, or they're very, very hard to be rubbed off. So this is a little bit different disease process. These white plaques are the first visible sign of HIV or human immunodeficiency virus, and it's also associated with Epstein-Barr virus. These patches will be slightly raised and rounded. If the leukoplakia is not associated with HIV, then you will see it in people that are over 40 and more men than women, although that's changing because of it seems like more women are smoking these days. They can be found anywhere, but lesions on the lips or tongue tend to be more cancerous. You can also see this from dentures not fitting well, broken teeth. Erythroplakia are red lesions on the surface of the oral mucosa. You can see these right below the teeth area. The erythroplakia have more malignant changes than leukoplakia. These are considered precancerous. You should do a biopsy on these, and they're more commonly found on the floor, tongue, and palate of the mouth. And that is the end of this video. And please be sure to look over your case studies. They'll just kind of help cement some of this information we've discussed.